New York's classic rock, Q1043.
I want to introduce you to Domineek Everett. She is an experienced registered nurse at Jersey Shore University Medical Center. And first, I have to tell you, Domineek, I was actually a patient there several years ago, and I had the most extraordinary care. It was a bike accident, and I fractured some ribs and punctured a lung.
Oh
And
my
the head
gosh.
and the head of trauma actually did the surgery to insert the tube into my lung in the ER. I mean, I just had the best. I love this hospital. I love the
hmm
hospital where you work, and I love the staff. So thank you for your good work. But the reason we have Domineek on today is because the nurses are just so overwrought and overwhelmed now with the Omicron variant of COVID. And I just wanted to get an idea from you of exactly what you're dealing with so that our audience knows and appreciates your good work.
Well, another surge is upon us. Nurses are working multiple shifts. Like a normal work week is 3 days, 12-hour shifts, and some nurses are working 7 days a week just
Wow.
to make sure that the staffing is appropriate so that we can provide the best care and continue that care that you've experienced.
How many nurses are out testing positive or suffering from COVID themselves?
I'm not sure of the exact number, but there are many that have gotten the virus and are out, and that is why my peers and even myself are stepping up to the plate and working extra just to make sure that the community is taken care of.
Have you gotten COVID yourself over
I
these
have
these
not, I
three?
have
Wow.
been blessed enough not to have had it.
And
And that's why proper hand hygiene and masking and everything is so important. Very important.
you wear the N95 masks?
Yes.
And do you
And
double
goggles.
mask? And goggles.
Um, yes. I do double mask, especially like in public, and like when I'm at the nursing station, I'll wear two regular masks. But when I go in the room, and even sometimes if there's a lot of COVID patients or I'm on a floor where there are like it is a COVID floor, I will wear my N95 for majority of my shift, almost all 12 hours.
What are you seeing in terms of the patients who are coming in this third wave, in terms of how many percentage wise are vaccinated, how many are not?
I do see a lot of unvaccinated people, and there are some that are vaccinated that are in the hospital with this new variant as well. So I would say maybe a little more unvaccinated, but there are vaccinated and breakthrough cases with it.
Hmm. And what sort of care do they need? Actual ventilators, or what is the level of care? I know it varies, but we've been through three waves now. I'm trying to get sort of a comparison here.
Yes. So I'm normally a neurosurgical ICU nurse. So I during when the surges pick up, that's when I start to take care of the more COVID patients. So with it being the surge picking up, and I'm handling more COVID patients, um, we hear code blues a lot on the COVID units. We hear the code blue alarms, and we're getting those admissions. Those transferred patients to the higher level of care that need the respirators and the vents and everything. And it's the ICUs are getting packed.
And at Jersey Shore Medical Center, are they still doing elective surgery at this point?
Yes, yes, right now we are.
We've heard talk in New York from Governor Hochul that she thinks Omicron has peaked in New York State. Has it peaked from your vantage point at your hospital?
Ugh. I hope it has, but from what I see, I think it might still be rising, unfortunately.
Yeah, it seems to be a different situation in New Jersey because it came through earlier in New York
Hmm.
City. And so this seems to have, a lifeline. And it seems from what we've seen with the figures, I think the positivities in New Jersey went down on Monday, but that was just one day. But the hospitalizations, I'm just not sure. Um, uh, People can get the vaccine at Jersey Shore Medical Center.
Yes.
And how is that going? Has there been an uptick with that?
Um, yes, people are still coming in, staff, I see people, my friends, my peers getting boosted. My family's vaccinated, they get boosted. Everybody's, you know, following the guidelines with that, and helping to provide safety for the community.
Are you seeing any admissions of, we talked about vaccinated versus unvaccinated, but have there been boosted patients that have been admitted to Jersey Shore?
That one is hard to answer because like I don't know if they're boosted or not. I just know if they're vaccinated or unvaccinated. So it's kind of hard to tell, especially when working in the ICU, you get the patients when they're really, really sick. Maybe if I worked on the non-ICU floors, I might be able to get a better handle of that.
What percentage of the ICU would you say are COVID cases right now? Or don't you have any idea?
If I had to pick a number, like um, we have some specialty ICUs that are taking on some of the COVIDs. So if I had to say a percentage, I would say one of our ICUs is completely COVID.
Huh.
Yeah. And then we have another one that seems to be transitioning into all COVID as well, ICU.
And are you seeing that you're not seeing the same numbers as you did with Delta and the first wave, are you? In terms of
I
hospitalization?
personally feel like we are. I feel like we
Wow.
are. I feel like the numbers are up. Yeah.
I am speaking with Domineek Everett. She is an experienced registered nurse at Jersey Shore University Medical Center and also a member of Health Professionals and Allied Employees AFT/AFL-CIO. And Domineek says that in this current wave of COVID, the Omicron variant in New Jersey, at least at her hospital, some nurses are putting in 7-day weeks. You have actually had to work 7 days a week?
I haven't done 7, but I normally do anywhere from 4 to 6 days a week.
So how do you handle the stress of all this? I mean, we
Uh,
are coming up on 2 years of this.
Nurses are getting very burnt out, unmanageable workloads, long shifts, moral distress, and again, like work home balance life has been rough, because you leave your job, but you still have a job to do when you come home to run your household, so nurses are feeling it like 24 hours a day because the hospital doesn't close, but the house doesn't either.
So what would help?
Well, I feel like, we should be learning from all of this, and as a whole, as a nation, we should be bridging gaps from the workforce to management to all corporations. We should be bridging this gap. We should be learning from this. And I feel like there are certain things that should be in place after nurses have dealing with this, like sustainable long-term mental support for nurses that have dealing with this, and just providing that to help keep them in the field. A lot of nurses are talking with their feet and walking out of the profession, and we really can't afford that right now. you know? So, important things like the employer and governments looking for incentives to encourage recruitment and retention, to keep people in the field. That's another important one. We need our nurses. Imagine hospitals with really, 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 really short nursing staffing, this would be unmanageable. And one of the last things is I think that nurses should be involved in the decision making around things like this, because we're some of the assets, so we should
Decision
be
making
more
in terms of what?
like how to deal with stuff, what can be done to make things better, staffing purposes, staffing things, what we need on a day-to-day basis, stuff like that. Just like simple decision making, and give more input and be heard more.
Does the hospital provide any mental health support for nurses?
We do have something that's called a code lavender. So like, when a patient is crashing, we have a code blue. And we have something called a code lavender that they provided, that which is something like it's basically like a timeout for a nurse. They have massage chairs, and it's like a relaxation and scents and stuff, to aromatherapy, to just help you decompress and relax after going through a situation.
I had heard that some nurses, and I don't know if this is true at your hospital, have quit at their hospitals to become traveling nurses because that pays so much more. And I had never even heard of traveling nurses till my daughter was hospitalized in the Scranton area. And basically, most of her nurses were traveling nurses and were telling me how well paid they were, and that they still had a home base, but that they only had to be at their home base for a certain amount of time over the year. But they seem very happy, I have to say.
Yeah, I have seen a few people leave to become travelers. I have.
And travelers are better paid?
Um, from what I understand, I believe so.
And how does that all work? Like, how do you become, who pays you to be a traveling nurse? How do people sign up to do that?
I don't know for sure because I'm a staff nurse,
Right.
you know, so I don't know exactly how it works, but I know they work through agencies, nursing agencies.
We only have a couple of minutes left. Is there anything you'd like to impart to our audience that we haven't talked about yet, Domineek?
One of the things that I wanted to say, just like really simply, is nurse, we're still giving everything we got. And like just like your experience you had, we still make sure we make that happen for every single patient that walks through that door. We want to try our best to make sure that we give the best care, and make the experience as best as we possibly can in such a situation, not the best time in your life, being in the hospital, especially in intensive care, for whatever reason. And I just want to say that, we all need to understand that we're all in this together, every single one of us. And if ever there was a time for all of us to bridge the gap between any gaps, from management to ancillary staff to nurses to government agencies, now is the time. We are all in this together, and together we can make big changes and improve a lot of things.
And if you could say anything to President Biden, what would you say?
Oh, that's a tough question. I would say, come talk to us. Come talk to us, sir.
That's a good point. Again, I thank you for your good work, Domineek Everett. I hope this third wave is the last wave. Domineek Everett, experienced registered nurse at Jersey Shore University Medical Center. Thank you so much for all you do.
Thank you so much.
Oh, you're welcome. If you have missed any part of this conversation, you can download the iHeartRadio app. It's free. And my interviews live on the podcast, Sonstein Sessions. And we're off for MLK Day. So I will see you with Jim Kerr on the Jim Kerr Rock and Roll Morning Show on Tuesday, Q104.3.
New York's classic rock, Q1043.